My name is Gaurav Gupta, and I work as a software developer at Lake County Health Department. And also, I co-found my evaluation pal, which is basically to the international credential evaluation. And currently, we have like a clients who uses. So yeah, so today topic is like LLM for smarter diagnosis. Uh, like I don't have like a visual data set for this study. Like I have like a two study in this slide. So it just basically I have like a textual data set for this topic. So I will go with next step. So the rise of LLM in healthcare. So basically, like when like a large language model like GPT 3.5 came to the market, and it's like everyone got excited, like how like things work in terms of like a coding, education, healthcare, like so like I had like a question like how things work like when we try to find something like suppose that I'm having like a headache or some kind of like issue, and I just giving all those symptoms to generative AI, and how those model will give me a output in compared to like when previously we always used to do like a Google, find out those unrelated articles. But through LLM it will give you like what you are exactly looking for in terms of like those prompt or different scenario. So for my two of the studies, I mostly uses like GPT-4 and their like different model like O3, O1 preview, and DeepSeek-R1 and Gemini. These are the model I have used because like these are like a publicly available. I'm not in this study. I'm not trying to like using like basically the model which are only for like a medical stuff or other things, like the model which are publicly available and anyone can use it. So I just want to like through this study I just want to make sure that how safe and how like effective, and like in terms of uh, like if someone is asking like medical diagnostic related question. So the study one was more like a uh, general diseases, and the study two was like more like a chronic, which I will go later when I will discuss about like both study in separate. And also I have not used any like a personal because uh, there's like a HIPAA compliance, and you have to like respect to that in US. I'm not sure about like other country because I work at healthcare, and like we guys really take seriously about those kind of things. So I have not used any personal information here, and yeah, and let's go to the slide. Yeah, and the motivation and context I already mentioned like a lot of things in previously, but again I will go with like there's a lot of like a diagnostic error. Like we are humans, and naturally we do like a lot of like error. uh, but when we have like some sort of like uh, uh, any application that backing us, like for example like AI tools, then like there is always like a two way to secure your what you are doing things. So healthcare providers, like especially healthcare providers, have like different kind of like overload working, and those kind of scenario. It's really hard to manage various things, like giving a factual report or maybe some sort of interpretations. And but LLM can like significantly help and increase the accuracy of, while like be a better uh, co-worker to like help with in the all different kind of analysis. So these tools are not like a replacement for like a doctor. Like currently like we see like a lot of like uh, we think that like AI will take job, but like but it's more like it's helping us, like as I'm software engineer, mostly like it helped me. Previously I have to go through all the like uh, different resources, but like the AI is like tool that's only I have to stick one, and it's pretty much give me what I'm looking for. So same thing for the doctors or like healthcare workers, the same way it will work for them too. So my study one is like it's published in MDPI AI journal. If you've like, I will share my LinkedIn, LinkedIn where I have like all the research paper included there. You can get it, and the more detail is in like paper itself. Like so, um, so for this paper, I have used like GPT-4, GPT-4o, Gemini o1 preview, and GPT 3.5. So all the data set, like I created one system which like go through the like different website and get all those like a general symptoms like a fever, uh, uh, diarrhea, uh, skin rashes, migraines, stuff like that. And throughout my studies, I created a one framework uh, which do like talk with models like GPT-4, Gemini, and I use a prompt where it asks all the like symptoms. Like every disease have like a unique symptom. Sometimes it's overlap though. For example, like a fever and cold flu. This type of this type of disease have like a common symptom. So it might like difficult for model to give us the exact answer that what we are looking for. So but I will leave this thing I will cover the later, because I have created like all those scenario, like how in each scenario I have evaluated like how it's hallucinate, how it's give us like a positive or negative result, or like sometimes it's like a true false positive, like even though it's incorrect, but we can say that like like 50% is right. So that's all belong to like like a false positive category. So yeah, we'll go through. So GPT-4 give us like a really good accuracy, and Gemini was like a complex because it's gave us like a pretty much reliable answer, like not higher not lower, but it was in like middle. And for the evaluation criteria, I have used accuracy, precision, recall, and alignment. Uh, GPT-4, yeah, again, like a GPT-4 show us like in terms of speed and accuracy, because it gave us like a pretty higher level of accuracy as well as like a confident score. And GPT 3.5 was not that good, but it also gave us like a reliable, like its answer. So the method and evaluation, I will talk here in the more detail. So as I mentioned earlier, that I have used like common symptoms. So it's like a fever, night sweats, weight loss, and all the response I have captured, and I do like a two-way validation. One is like firstly like I created one Python script where all the result which I have got and all the like data I have collected, that will validate. And also uh, I did like a third evaluation with one of the healthcare worker, so that like whatever I am claiming, whatever I'm trying to achieve through a study, it's all like dual validation. And also each prompt was like the just chain of thought, like how like so that model can easily understand that what I'm asking for, like I just don't want to be aware that I'm going to do like some kind of test or anything like that. It's just like I just want to make sure that it's just like a general conversation with them. So so the metrics I have used for here is like accuracy, precision, recall, and if one is good. These all are the metrics based on like how we evaluate like other models like machine learning and other things. So I just use that things. And For the symptoms, I have used like around like a 50 for like each model. So around like a 250 data set I have. So the result and the confidence score. So the as I have mentioned that like GPT-4 was throughout the models like performed like very well in terms of like all the aspects, uh, where it's like true, false positive, false negative, and also for the correct and incorrect predictions, and as well as like a precision, recall, and accuracy. So like in all scenario, GPT-4 was like a winner. Although like currently mm, GPT-4 or O1 preview were like a latest model, because GPT-4 was really old than that, and I was really surprised at how like that the old model performed better than what they are like giving us. And also in terms of like in general perspective, whenever I use like others model for them, so I believe like GPT-4 was much better like in terms of coding and other general tasks, but I don't know why they are keep degrading stuff. So in all three scenario, I found that GPT-4 was the winner. And here the all the like precisions and also also I was surprised that how uh, although GPT-4 was the winner, but if you are talk if you are see like how GPT Gemini got the higher precision than GPT 4. So that's why I think like Gemini was like a more reliable. Also you can see that how confidence was like a GPT compared to Gemini. Like Gemini always like uh, the reason I mentioned that like hallucination is the biggest problem for the all the model currently we have right now. But this study was like a last year, but currently we have like a better than But I will cover those in my like further study. So GPT always have like a higher confidence score than Gemini, and Gemini have like a low confidence as well. Other models we don't have like a low confidence, so Gemini precision was better. So later, after I done with the study one, and this time to that was just like a common scenario, disease scenario, So I was just like want to get like a more know that how it will perform in chronic diseases, and some of the things which I have not done in the previous studies, like I have not categorized all the diseases, but here in the study too, I did categorize all the diseases in like a diabetes, because diabetes also have like a lot of type, as well as like a mental health, neurological, oncologic, autoimmune disease, and respiratory disease. So every disease have like a different kind of. So I just kind of like a categorize so that like we can better analyze like which model perform on which disease category. So the result was really surprising, and I have not used like a previous model. This time I just compared like DeepSeek-R1 and O3 Mini, because these two models were trending at that time. And also the DeepSeek one really surprising that like due to like very few resources they use. Resources means like uh, the memory, the processor, and other stuff, where like O3 mini is too much resources they use and really hard to operate. So I just want to make sure that like even though DeepSeek R1 is like really uh, uh, less power and like less maintained to use, so how DeepSeek will work in this kind of scenario. So I just kind of evaluate and compare like both performance. So what I found, like DeepSeek performed really better than disease level accuracy, as well as like 88% in category level, as well as like a 92% high in confidence, where O3 mini just uh, 72% in disease level and 78% in category level, and 68 100% in high confidence, which is really like I was surprised that, like O3 mini, like GPT, family of GPT is always, uh, like a better and compared to the newer model coming to the market and, like winning those kind of throughout the evaluation process. So it was really surprising. And also DeepSeek one R1 got like their 100% accuracy in neurologic, mental health and oncology, whereas like O3 Mini achieved 100% just in autoimmune disorder. Both models like struggle in respiratory disorder because I believe that because of their poor performance, because respiratory disease have like common symptoms, so they align with each other. So I believe like when even when we are human, we're trying to interpret like two similar things. It's really difficult to like analyze like which one uh, is the context is all about. So same goes to the model too. If the if symptoms have like a common things, then it's really hard to the model to recognize like what we are asking. So I think that's why it's struggle, and that's what I have found in study one. Um because of that, model has hallucinate and give us like like not good output what we are asking, and so stuff like that. I think that's the reason respiratory disease, both models perform very poor on that. So for the study two, I have again I have used like 100 clinicals, uh, disease list, and those all disease I make it in category so that it will easier to me to evaluate and say that like where it perform better, where it's not. And again, same criteria. I use the prompt, like chain of thought, and asking them created a framework in Python where API calls, uh, asking the prompt, and whatever the result I get, I collected into the CSV file, and then where I do all the analyzation. These all the data set are available in my GitHub. Also, in if you go to my research paper, and I have shared that like GitHub file where you can get all the data. Uh, so the prompt outputs I have got all in five of specification, disease classification, specific diagnosis, and confidence score. And also this time I have in study one I have not included the like what will be the next step, and what was the reason behind like why if you are claiming that I have a fever. So like how like what's the reason behind like why you were saying that I have a fever, so stuff like that I have put in the study too. And the scoring criteria, if the model predict correct disease, they got one. If not, then like it's a 0 point. So that's how. And also I have asked like a high, medium, low, how confidence you are on this answer, so that we can better know like how they can work uh, in different kind of situations. Like for every time like anyone work, they have like workload. Sometimes like a model perform in high kind of high situation, mediums or low, like those kind of things. I just want to know that high, how much confidence are you on this answer, stuff like that. And yeah, so as I mentioned that like a DeepSeek, so in every perspective, DeepSeek R1 perform very better in terms of confidence and as well as correctness, and O3 Mini only perform in autoimmune but weaker in respiratory disease. So for the study two result, I got the disease level accuracy for the DeepSeek 76%, whereas O3 Mini 72%. For the category level, 88% for the DeepSeek, and O3 Mini for 78. over accuracy, DeepSeek 82%, and O3 Mini 75%. So you can see like in every aspect, in even figure two, uh, all the categories, we can see that DeepSeek R1 is like a winner on that. And also the confidence score for the DeepSeek is always higher than compared to O3 Mini. But I was surprised that like previously in study one, in every if we are talking about the confidence, GPT-4 was like much better in terms of confidence, but here we can see that like only 29, and some are like a medium for the O3 Mini, whereas like a DeepSeek R1 was like more confident. So we can say that like a DeepSeek R1 was like more trustable and more kind of winner on that. So that's why it's always good for like a more confidence on that. Again, same comparison. So diagnostic trust and confidence calibration. So these are the things, like as I was not evaluating like a, like a medical expert model. It's just like publicly available things, and a lot of healthcare workers, doctor, nurses, want some kind of reliable sources, because AI is a tool and it's a publicly available. So everybody want to kind of use of that. So according to me and like my both study, I think like for the general purpose, like healthcare worker can use that without sharing the personal informations. um, it just give us their like a backup, like a second opinion. if 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 they want to use it, it's pretty good tool. But 100% reliability is like I don't think so we can rely on 100%, because there are so many like disparity and incorrect answer. So like 100% reliability still is not achievable throughout like every model. And also uh, also like the next step will be like how like will be performed in like a multi-model data. Currently me and my team like working on the multi-model data set, and as well as like a is AI agent. I will go through in other slide about that. That's our in future work. So 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 real world application, we already know like clinical chatbots. Like there are like different companies which are offering this kind of services. Uh, Nurse track support, which I already discussed. Uh, Second opinion tools without using personal health informations. And also like if we are not sharing any kind of personal information, that is totally HIPAA compliance. And as well as like for the HIPAA compliant issue, if you are really worried about that kind of things, then you can like deploy that model into your own environment. There are so many open source model available. Or like there's like other companies who also like kind of fine tuning the model and selling them, and deploying help other healthcare companies to deploying in their environment. uh, so uh, so there's like a lot of things like a way to healthcare worker can use that uh, uh, into the healthcare setting. One is like a framework, one in there like a EHR kind of uh, box, where it's kind of like a every healthcare have like a EHR, and where they can kind of create like a chatbot, and put some kind of information into that, and uh, give us an idea like what they are looking for in like different kind of scenario. uh, so technical and clinical challenges. So as I mentioned that like how like a similar symptoms can create a disparity. So minor change in the word can like give us like a wrong output, which is not good at all. And hallucinations, like sometimes sometimes when you keep asking, uh, they they are not giving you what you're looking for in terms of like they they will react like in some other way as well. Like uh, if you don't fine tune them like a model, even if you ask them like some kind of like a general uh, disease related question, then model will not answer you because uh, uh, because you are asking uh, sometimes of like uh, critical questions, so like OpenAI or like a Google, they kind of hide you to they kind of train the model that will not give the like that kind of sensitive information. So that's also is a risk. Uh, Currently lack of multimodal reasoning. So like we need to more study on like a multimodal data like images, uh, text, images, voice, sound, or like a different kind of scenario. We still need to study on that. Uh, Also, the overlapping system challenges moral differentiations. So many like symptoms come around like similar, so it might be difficult. And also like a deployment, in terms of deployment perspective, how uh, it will be easier to uh, challenge that HIPAA stuff. Maybe sometimes mistakenly we share the personal information, and which is not uh, kind of uh, uh, operate with HIPAA. So we have to take care of that too. So for this both study, I have like not use any real patient data. It's just like all the uh, data that are available in reputable sites like a Cleveland Clinic, Mayo Clinic, WHO, stuff like that. And also all the prompt and everything was pretty much like a general prompt, just like a chain of thought, so that model can easily understand. And in terms of hallucination, they will not, give us like a different kind of opinion or anything like that. So it was pretty simple. And all the outputs were like um, is in the um, validated by a healthcare worker. And um, uh, I also did all the whatever the answer I got, and whatever the already I have in my things, I match and make sure that everything is like a secure and everything. And as I mentioned, I have not used any personal information, so everything was in kind of generality. Uh, for uh, uh, for the responsible integration, like if we are using for like uh, some sort of like giving a second opinion on like a different kind of disease and uh, scenario in healthcare, we can also like use this kind of LLM platform or generative AI platform in like a communicating between external or internal server or like database. Or maybe suppose that you are transferring the data from like one application to other application, how will be secure, how so you don't have to do the any manual intervention, manually interface. So these are the things that are like coming right now, like MCP just recently came. And I already started working on this MCP one. So I think in future I will have any kind of a study there. And yeah, so it's really interesting, like how integration will change as soon as we move forward with like more with generative AI. So the future work, is more like we in study one, in study two is just like a general talking with large language model, and which is again like we are talking through like some sort of script or coding or maybe like prompt. But in future and in I was trying to make like agent can like able to communicate with all those models, and and they are the one who are doing like creating symptoms, uh, feeding to the models, getting the answer, all the things I'm looking for, like, like in future work, agent AI to all those things, so that like each step there will be no like manual interventions and anything like that. So like I'm really interested in this new project, so hopefully I have something uh, in next few months. So key takeaways, LLM are not like a replacement, it's just like a second opinion. uh, we can like we can use like a LLM tool without giving a sensitive data, and all those bias and hallucination are still difficult. uh, Agent will be definitely a next future in terms of like move forward with those kind of like all those challenges, maybe agent can solve. uh, Although like some of the like there's a side back drawbacks, but still like I think LLM is a really good tool through that study. And GPT-4 and DeepSeek-R1 like winner on that kind of study. uh, we should also like responsibly use. We don't 100% rely on those answers. um, yeah, so yeah, so future direction will be definitely more learn about like how agentic AI will work in the healthcare system. More the more the progress, the more different AI and different libraries will available for like people like us who can make and create something for companies, something for the world. So yeah, now this time for the questions.
All right, fantastic. So let's take two or three questions before we wrap things up here. So this first question came during the comparison slide, which was early on where you were comparing Gemini, GPT. The question is around confidence. How was confidence defined for the study?
So confidence is mostly like how the model are like better, like giving a good, like suppose that if i- suppose that if I have asked any question with models, if they are not like confidence on that, so they will do the further research, like in background, and they if they are not sure, then they come up with different answer, different things. But if the model is like 100% sure, like if they have like a good amount of data they have studied previously, then it will definitely give us like a pretty good answer on that. So I think the more model was confident, the more accurate answer was. And also like sometimes the model is more confident, but the answer was totally wrong. Only few times I have found.
All right, let's take two last questions. The next one is what sort of minor changes in the prompt wording did you notice impacting the results? So I suppose, does anything stand out to you in regards to making subtle changes to the prompting that actually delivered some significant change in what you got back?
Like, are you talking about the prompt? Like significant change in the prompt will give us like a different answer. Yeah,
Correct.
yeah. Like, if you give us like a lot of informations, like you will not clearly say what you are looking for. Like I just put the all the symptoms, and hey, I'm just looking for like just one word, uh, uh, like a disease name, and how much confidence you are on that your guess, or like whatever you are. So you have to be very specific. If you do not ask or give us prompt on that way, then model will definitely more hallucinate and give you the improper answer, or you have to probably uh, give that prompt again. So in one run it's really very difficult. But now the models are like more better than the what I had last year. So
All right, well, let's take one last question. Could you please say more about the bias auditing, the way that you integrated different personas alongside the conditions? Was this multiple personas per condition or distributed across conditions? How were the persona identified?
like what bias you have mentioned?
Bias auditing.
uh sometimes when there's like a similar symptoms, like for like mostly common like cold and fever and migraines, like these are like a very common symptoms. So when you have these kind of symptoms, like model like Gemini and 3.5 was really biased on that, and they just give you like just one just like for, even though the symptoms were like a different common, but it still gave you like a same answer like migraine for that. Even I was asking for like a flu and other things. So